Immune response. Acquired immunity is characterized by the memory. Whenever body encounters a pathogen for the first time, it produces a response called the primary response, which is of low intensity. Acquired immunity is characterized by the memory. Whenever body encounters a pathogen for the first time, it produces a response called the primary response, which is of low intensity. Subsequent encounter with the same pathogen elicits a highly intensified secondary response, which is ascribed to the fact that our body appears to have memory of the first encounter. So the secondary response is of highly intensified cause of the fact that the first or the primary response have the memory of the pathogen. Autoimmunity. It refers to abnormal immune responses in which the immune system fails to properly distinguish between self and non-self, self and non-self body proteins. Distinguish, okay? When own body cells act as antigens, they are called autoantigens. When own body cells act as antigens, they are called autoantigens. Some of the examples of the autoimmune disorders are the Graves' disease, rheumatoid arthritis, rheumatoid arthritis, myasthenia gravis, myasthenia gravis, then the pernicious anemia. There are some of the autoimmune diseases. We have immune system in human body. The immune system consists of the lymphoid organs, tissues, cells, and soluble molecules like the antibodies. First is the lymphoid organs. These are the organs where origin and the maturation proliferation of lymphocytes occur. The primary lymphoid organs are the bone marrow and thymus, where immature lymphocytes differentiate into antigen sensitive lymphocytes, where origin and the maturation and the proliferation of lymphocytes. Lymphoids occurs in the lymphoid organs. The primary lymphoid organs bone marrow and thymus, where immature lymphocytes differentiate into antigen sensitive lymphocytes. The thymus is a lobed organ located near the Located near the heart and beneath the breastbone. That is sternum. It is a quite large at the time of birth but keeps reducing in size with the age, and by the time puberty is attained, it reduces a very small size. Both bone marrow and thymus provide microenvironments for development and maturation of the T lymphocytes. After maturation of the lymphocytes, they migrate to secondary lymphoid organs, which is spleen, lymph nodes, tonsils, pairs, patches of small intestine, and appendix. The secondary lymphoid organs provide the sites for the interaction of lymphocytes with the antigen, which then proliferate to become the effector cells. They provide the environment for interaction of lymphocytes with the antigen. The spleen is a large bean-shaped organ which mainly consists of spleen is large bean-shaped organ. Lymphocytes and the phagocytes. It is the filter of the blood. It acts as a filter of the blood by trapping blood-borne microorganisms. It filters blood. It also has a large reservoir of erythrocytes. The lymph nodes are small solid structures located at different points along with the lymphatic system. Lymph nodes serve to trap microorganisms or other antigens. They trap antigens which happen to get into lymph and tissue fluid. Antigens trapped in the lymph fluids are responsible for the activation of the lymphocytes present there and cause the immune response. Lymphoid tissue located within the lining of the major tract, that is respiratory, digestive, and the urogenital, called the MALT, which is the mucosal associated lymphoid tissue. Mucosal associated lymphoid tissue constitutes about 50% of lymphoid tissue in human body. The next is the antigen. These are the substances when introduced into the body stimulate the production of the antibodies. Most antigens are proteins, but some are carbohydrates, lipids, or nucleic acid. Antigenic determinants or the epitopes are those sites on antigens that are recognized by the antibodies and receptors present on T and B cells. Antigenic determinants and the epitopes. These are the sites on the antigen which are recognized by antibodies and receptors present on organ transplantation. Transplantation involves the removal of the damaged or injured tissue or organs from the body of a person and their substitution by similar tissue organs from a donor. Tissue matching and the blood group matching are essential before undertaking any graft or the transplant. Sometimes the immune system may reject the transplanted organ by recognizing its protein as foreign. Therefore, patient has to take immunosuppressant drugs to prevent organ rejection throughout the life. The success of tissue and organ transplantation depends on the donors and the recipient's human leukocyte antigens. Human leukocytes antigens. Encoded by the HLA genes. The genes for the HLA proteins are clustered in the major histocompatibility complex located on the short arm of chromosome 6. HC. Major histocompatibility. Complex located on chromosome 6. The success of the tissue and the organ transplantation depends on the donors and the recipients' HLA genes, or the genes for the HLA proteins are clustered in the major located on the histocompatibility complex. AIDS. Acquired immunodeficiency virus causes HIV core disease syndrome caused by HIV syndrome. AIDS is a disorder of the cell-mediated immune system of the body. There is a reduction in the number of the helper T cells which stimulate antibody production by the B cells. This results in the loss of the natural defense against infections. Reduction in the helper T cells. Basically reduce in the cell-mediated immune system. The incubation period of the AIDS ranges between 6 months to 10 years. It is the incubation period of infection by HIV. Virus enters the body of a person and reaches to the macrophages cells of the immune system. When the virus enters, it directly reaches to the macrophages, which are the cells of the immune system. The viral RNA is converted to viral DNA with the help of reverse transcriptase enzyme. Viral RNA is converted to viral DNA with the help of the reverse transcriptase enzyme. Viral DNA is incorporated into the host cell's DNA. The viral DNA replicates along with the infected host cell. Thus, the infected macrophages act as HIV factory. The viral DNA replicates along with the infected host cell. Replicates along with the infected host cells. Thus, the infected macrophages act as HIV factory. The viral proteins formed are assembled to form new viral particles which are released from the infected cells. They mature and target T cell of the body and destroy them. Since the number of helper T lymphocytes decrease in the body, the person becomes susceptible to infections of bacteria, especially mycobacterium, viruses, fungi, and even parasites like toxoplasma. The patient gets immune deficient and she is unable to protect himself against these infections. Transmission of AIDS virus. It can be transmitted through the use of contaminated syringes to inject drugs or the vaccines, use of contaminated needles for boring pinnae for infected mother to child through placenta, transfusion of the infected blood, use of contaminated razors, artificial insemination. Symptoms of HIV infection include fever, lethargy, pharyngitis, nausea, headache, rashes, etc. A widely used diagnostic test for the AIDS is ELISA, which is enzyme-linked immunosorbent assay. Treatments of AIDS with the ELISA, enzyme-linked immunosorbent assay. Treatment of AIDS with the antiretroviral drugs is only partially effective, which can only prolong the life of the patient but cannot prevent death, which is inevitable. Prevention of AIDS comes under NACO, National AIDS Control Organization, and other non-governmental organization, which is the NGOs, doing a lot to educate people about AIDS. WHO has started a number of programs to prevent the spread of HIV infections. Next is the cancer. It is an abnormal and the uncontrolled division of cells that invade and destroy the surrounding tissues in our body. Cell growth and differentiation is highly controlled and regulated. However, in cancer cells, there is breakdown of these regulatory mechanisms. Normal cells show a property called contact inhibition. Normal cells show contact inhibition, by virtue of which contact with the other cells inhibit their uncontrolled growth. Cancer cells appear to have lost this property. As a result of this, cancerous cells just continue to divide, giving rise to masses of cells called the tumors. As a result of this, cancerous cells just continue to give rise to masses of cells called tumors. By virtue of which the contact with other cells inhibit their uncontrolled growth, and the cells appear to have lost this property. Okay, tumors are of two types, that is of the benign and the malignant. Okay. Benigns are the normally remain confined to their original location and do not uh, spread to other parts of the body and cause little damage. They can cause serious problems when they grow near vital organs or the restrict blood flow. Malignant are the mass of proliferating cells called the neoplastic or tumor cells. These cells grow very rapidly, invading and damaging the surrounding normal tissue as these cells actively divide and grow. They also starve the normal cells by competing for the vital nutrients. Cells slowed from the such tumors reach distant sites through blood, and wherever they get lodged in the body, they start a new tumor there. This property is called the metastasis. Is the most feared property of the malignant tumor. Metastasis. It is a cell slowed from the such tumors reach distant sites, and wherever they get lodged in the body, they start a new tumor there. Yeah, causes of the cancers. Cancer. Transformation of the normal cells into cancerous neoplastic cell, which may be induced by the physical, chemical, or biological agents called the carcinogens. Ionizing radiations like the X-ray and the gamma rays and the non-ionizing radiations like the UV rays cause DNA damage leading to neoplastic transformation. Cancer-causing viruses called the oncogenic viruses have genes called the viral oncogenes. Severe genes called cellular oncogenes or proto-onco have been identified in the normal cells which when activated under certain condition could lead to oncogenic transformation of the cells. Then we have cancer detection and the diagnosis. It's about to rain. Diagnosis. Cancer detection is based on the biopsy and histopathological studies. Of the tissue and blood and bone marrow test for the increased cell counts in the case of leukemia. In biopsy, a piece of the suspected tissue cut into thin sections is sustained and examined under microscope. That is histopathological studies by a pathologist. Techniques like the radiography, CT, computed tomography, MRI, magnetic resonance imaging are very useful to detect cancers of the internal organs. Then we have computed tomography. Use X-rays to degenerate a 3D image of the internals of an object. MRI uses strong magnetic fields and the non-ionizing radiations to accurately detect pathological and the physiological changes in the living tissue. Antibodies against cancer-specific antigens are also used for detection of certain cancers. Techniques like molecular biology can be applied to detect genes in the individuals with inherited susceptibility of certain cancer. Treatment of cancer. The common approaches for the treatment of the cancer are surgery, radiation therapy, chemotherapy. Immunotherapy. In radiotherapy, tumor cells are irradiated lethally, taking proper care of the normal tissue surrounding the tumor mass. Several chemotherapeutic drugs are used to kill cancerous cells. Majority of drugs have side effects like the hair loss, anemia. Tumor cells have been shown to avoid detection and the tumor cells have been shown to avoid detection and destruction by the immune system. Therefore, the patients are given substances called the biological response modifiers such as alpha interferon, which activate their immune system and help in destroying the tumor. Alpha interferon, which are the biological response modifiers, which activate their immune system and help in destroying the tumors. Then we have the drugs and the alcohol abuse. The drugs which are commonly abused are the opioids, cannabinoids, or the coca alkaloids. Opioids, cannabinoids, coca alkaloids. Majority of these drugs are obtained from flowering plants, and some of them are obtained from the fungi. Two categories of the drug include are the psychotropic and the psychedelic. Psychotropic psychedelic. Psychotropic are the mood the altering drugs that affect behavior. They are mood altering, affects behavior and mental activity of person. Okay, these are also further classified as the sedative, opiates, and the stimulants. Caffeine and cocaine also comes under this. Sedatives and hypnotics. Then we have opioids, narcotics. Then we have stimulants. And caffeine and cocaine also is included under this. So sedatives, these are the reduces excitement, pain, and lowers the physiological or functional activity leading to drowsiness or sleep. Hypnotic induces sleep. Sedative and hypnotics include barbiturates and the benzodiazepines. They include barbiturates, benzodiazepines. Okay. Opioids are the drugs which bind to specific opioid receptors present in our CNS and gastrointestinal tract. They are analgesic, painkiller, which is painkiller. Analgesic means painkiller. Okay. Morphine is a very effective sedative and the painkiller, and it is very useful in patients who have undergone surgery. Have undergone surgery. So opioids and the narcotics include morphine, heroin, which is diacetyl morphine, commonly called as smack or brown sugar, which is a white, odorless, bitter crystalline compound. It is a depressant that slows down body function. Slows down the body function. It is a depressant, okay? This is obtained by the acetylation of morphine. Acetylation of morphine, which is extracted from the latex of opium or poppy. ये poppy का or poppy plant, which is Papaver somniferum. Papaver somniferum, generally taken by snorting and injection. We have stimulants. These drugs stimulate the nervous system, make a person more wakeful, alert, and active, and cause excitement. The principal stimulants are the caffeine and cocaine. Caffeine is a white crystalline bitter alkaloid obtained from the leaves of the tea plants Thea sinensis. Seeds of coffee plants Coffea arabica. It is 137 trimethyl xanthine and it stimulates CNS. 137 trimethyl xanthine and it stimulates CNS. Cocaine or coca alkaloid is obtained from the coca plant, which is Erythroxylum coca. Erythroxylum coca, native to South America, which interferes with the transport of the neurotransmitter dopamine. Crack is highly addictive, smokable derivative of the cocaine. Smokable derivative of cocaine. It has potent stimulating action on the CNS, producing a sense of euphoria and increased energy. Excessive cocaine dosage causes hallucinations. Amphetamines are the synthetic drugs. They are CNS stimulants. Amphetamines. These are the synthetic drugs. Okay. They are CNS stimulants. They are normally used as the medicines to help patients cope with mental illness like the depression and the insomnia. Amphetamines. Then we have the psychedelic drugs. They change one's behavior, thoughts, feelings, and the altered professions. These include chemicals such as cannabinoids, datura, and the belladonna. Cannabinoids. They are a group of chemicals obtained from the hemp plant which interact with the cannabinoid receptor, principally in the brain. present in brain. Okay. And the flower tops, leaves, and the resin of the cannabis plants are used in various combinations to produce bhang, marijuana, hashish, charas, and ganja. Bhang, marijuana, charas, ganja, hashish, charas. It's looks like some brothers or sisters' name of family. And ganja. It will be good if somebody named their kids as these. I mean, if someone have 5 kids, they can name them the bhang, marijuana, hashish, charas, ganja. These are generally taken by the inhalation and oral ingestion and effect on the cardiovascular system of the body. These days, cannabinoids are being abused by some sports persons. Then the another psychedelic is the datura and belladonna. Seeds of datura, stramonium. And aerial parts of the Atropa belladonna. Atropa belladonna are misused for the hallucinogenic properties. However, even in slight excess, they can cause death also.